name is Grace Hall, and today I'm going to be giving a speech on respiratory therapy. Beside me, I have my audience who's going to introduce themselves.
Hi, I'm Carson Hall. I've served in the United States Army for about 5 years, and I have served my time as a 68 Whiskey, which is a combat medic.
My name's Kayla. I'm a nurse and I have a history in emergency medicine as well as public health.
Thank you guys for being here today. I want to start off with an example that probably resonates with the both of you. So let's think. Imagine a patient collapsing in front of you, unable to breathe. While the doctors and the nurses are going to come in, there's also going to be another professional right behind, the respiratory therapist. A role that is too often underfunded and understaffed. Proper respiratory care in emergencies is not optional. It saves lives. Respiratory therapists provide critical interventions during cardiac arrest, respiratory failure, and trauma. According to Johnson and Patel, in 2022, hospitals with dedicated respiratory therapists in emergencies see higher survival rates because RTs manage airway support, ventilation, and oxygen delivery in real time. Yet, many hospitals are understaffed. Not all emergency departments have 24/7 respiratory therapists on call. The American Association for Respiratory Care in 2023 notes that understaffing leads to delays in care, putting patients at higher risk for complications and even death. That's terrifying, right? Investing in RTs also makes economic sense. More RTs reduces ICU stays, prevent ventilator-associated complications, and improves the workflow for doctors and nurses. You know, you guys' workload already piles up as it is. Therefore, when everybody has their assigned duties, it's going to make that flow a lot quicker. And if you ask me, it's going to make the patient's care much better. A 2021 study in Respiratory Care Journal found that hospitals with higher RT staffing reduced ventilator complications by 30%, saving money and improving outcomes. Now, 30% doesn't sound like a big number in the grand scheme of things, but when it comes to saving lives in the medical field, 30% is major. Professional recognition and retention is also equally important. Hospitals that invest in professional development for RTs see higher retention rates and greater patient satisfaction, which is all important around the table. A stable, experienced workforce ensures consistent, high-quality care in emergencies. Some may argue hiring RTs is too expensive, but the cost of staffing is far less than the cost of preventable complications, extended ICU stays, and lost lives. Lost lives, they're priceless. I think it should be obvious that we should focus on getting more RTs in the hospitals to ensure the safety of these patients and oxygen airway. I mean, as we all know, oxygen is literally life. Without that, it doesn't matter what you have going on. So to have somebody to stabilize that while you guys can assess the rest, I think that's a really good team and strategy and something we as healthcare professionals should definitely work on. Investing in respiratory therapists is not only ethical, it's practical. Respiratory therapists have been described as indispensable in emergencies, just like you guys. As a team, I think we can have a really good shot at having a good chance at saving lives and having an easy workflow together. Every second counts in an emergency, as you all know. By supporting respiratory therapists, we ensure that trained professionals are ready to act when a patient struggles to breathe, and more lives are saved as a result. The choice is clear. Let's invest in the experts that save lives every single day. I've told you guys all about the who's, what, when, where, whys. Now I want to ask, do you guys have any questions?
In critical settings and situations, how does the shortage affect other staff members like nurses and physicians?
So you guys already have so much you're dealing with, right? By having somebody who can just focus solely on the breathing and oxygen levels, which you guys would normally assess, you guys can assess the wounds, what they need, fluids. You guys can do your job more efficiently And it takes a workload off of both of you, the doctors, the nurses, and anybody else involved. You know, you guys' workload piles up as it is, so to have somebody on call and ready to assess that specific area, that gets off your hands, right?
So I get out of the Army shortly, and I want to stay in the healthcare field, and respiratory therapy sounds intriguing to me. What are the school requirements for it?
So the school requirements are gonna be your prerequisites, of course. Now those do vary between the schools that you select. You might have to take PACE, which is like a kind of determination test, to put it. And then you're also gonna take your anatomy, physiology 1, 2 with a lab. You're probably gonna have your biology courses as well. Like I said, that just factors. You're gonna have some maths thrown in, so you just wanna make sure you check with the school you're applying to and all the schools you're applying to. Now the school itself is going to be anywhere from 20 to 18 months. That also varies on the school you choose. Either way, I think with the prereqs and that, you're going to always just want to bet on about 2.5 years, which is a pretty good deal for the job you get. Financially, physically, it's a great job to have, and it's crucial that we have respiratory therapists. Do you guys feel like this speech has opened your eyes to who respiratory therapists are?
For sure, definitely.
For sure. A lot of people have never even heard of respiratory therapists, which is crazy. I didn't before I was introduced to one myself. Have you guys ever heard of one?
I have not.
You haven't?
Just through work.
You have through work, right? And would you say that your hospital is staffed well, understaffed?
Definitely not, especially on night shift. There's maybe like 1 or 2
Okay.
respiratory therapists.
Yeah. Have you ever seen a respiratory therapist in action?
Yes.
Yes. Do you think that what they do is pretty powerful and it helps you?
Yes, and I think it helps out with like that ratio too that you were explaining.
Yeah, takes a workload off of you. Well, any more questions, or do we think we're good?
I think I'm good.
Good.
All right. Well, thank you guys for listening to me, and I hope we get a good takeaway from this. Thank you.